Hello and welcome to Don't Freak Out, quick videos on the kids' health we don't talk about. For the next videos, we have a special treat because I'm joined by Dr. Christine Finck. Dr. Finck is the chief of pediatric surgery at Connecticut Children's, a world-renowned researcher in tissue engineering and mom to 3 great kids who are a little older than mine, but we're still totally game to be in these videos. Hope you enjoy.
So your child needs a gastrostomy tube. Don't freak out.
What is a gastrostomy tube?
A gastrostomy tube or Gtube is a special tube used to feed your baby or child.
Why do you need a Gtube?
Gtubes are used when kids can't swallow or take medication by themselves.
Gtubes can be easily placed because the stomach, where the food goes, lives right up against the front of your belly. That means that a surgeon can safely put a short plastic tube that allows you to feed food or medication directly into your child's stomach.
There are many kinds of Gtubes. This is our nurse, Marie.
Your surgeon is going to work with you to determine which Gtube is best for your child. This type of Gtube has a silicone mushroom to hold it in place. This type of Gtube has a balloon that we fill with water to keep it in place.
This is how you connect a Gtube. See here, there are 2 black lines. Make sure when you put it in, it's all the way in. And then it says lock, you just turn it and it's locked in.
Your surgeon will talk with you about the best way to put in the Gtube. It is placed during a surgical procedure while your child is asleep.
You may think that taking care of a Gtube is hard. Don't freak out.
The most important thing about taking care of a Gtube is to keep it clean and dry. Remember to always wash your hands.
Every day you will wash around the Gtube, rinse well, and pat dry. Then you have to give it 1 full turn, just like you would do a brand new earring.
Gtubes can have problems, but don't freak out. We can help.
The most common problems with a Gtube is redness or irritation at the base of the Gtube. Usually keeping the area clean and dry helps to prevent that. Another problem that can occur is to have some leakage coming from the tract or the opening into the skin. Usually that's because the balloon is not filled well enough or the Gtube is no longer fitting quite well. Keeping the balloon filled by checking it every few weeks will help, and as well keeping your follow-up appointments so your doctor can monitor the site. The last problem commonly seen is extra tissue growing at the base of the Gtube. That usually occurs because the body is trying to close up this new opening that wasn't there before. Applying a special cream ordered by your doctor usually takes care of that within a week or 2.
Some parents worry what would happen if the tube fell out. Don't freak out.
The good news is that this rarely ever happens. If it does, just cover the opening with some gauze and make your way to the hospital to have it replaced. Believe it or not, many parents choose to learn how to replace the tube. That way, should it fall out or get pulled out, once it's fully healed, they can take care of that at home.
Okay, sounds good so far, but what about activities? There are no activity restrictions with the Gtube. You can run, jump, and swim.
I hope that this answered some of your questions about Gtubes, and most importantly, that you
Don't freak out!